Hello, everybody. My name is Michaela Pascoe. I am from the Institute of Health and Sport at Victoria University. And today I'd just like to give you a brief overview of mindfulness research in the field of psychological health. So what we'll cover essentially is a brief definition of what mindfulness is, what the evidence is that mindfulness improves well-being, and we'll also take a brief look at some of the psychological mechanisms via which mindfulness can improve well-being. So essentially, mindfulness in the West can be defined as paying attention on purpose to the present moment from a perspective of non-judgment and acceptance. So this little image says it all, I think. Here we have the father who is in the park with his daughter, but his mind is everywhere else. He's simply not where he is. The little girl, on the other hand, is present. She's engaged with her environment. Her mind is where she is. Mindfulness in the West is independent of any philosophy, ethical code, or system of practice when we're looking at it in the context of psychological health or well-being or as a psychological intervention. And mindfulness has been used in the space in a psychological setting and in a clinical setting since about the 1970s. So we'll talk a little bit more about each of these different mindfulness interventions shortly. But just as a background, we can see that it sort of came in about 1970 with mindfulness-based stress reduction and then grew in popularity over the next decades. And in non-clinical settings, meditation and yoga asana practice, which is essentially yoga postures or yoga movement practices, have also become quite popular. And of course, this has corresponded with an increase in research into mindfulness-based interventions and therapies. So you can see here the number of publications per year. And we see that from about 2000 onwards that it starts to increase. And really from about 2010 onwards, it just really explodes. In 2018, we can see that there were almost 700 publications with mindfulness in the title in that particular year. So now we'll talk a little bit about some of those psychological approaches or interventions that we mentioned earlier. And we're going to start or go through them chronologically. So we'll start, of course, with mindfulness-based stress reduction, which was the earliest to sort of enter that space. Originally, it was developed as a approach to manage chronic pain. And it's quite an intensive and structured program. It goes for about 8 to 10 weeks, requires a few hours a week, up to 3 hours a week of time or commitment from participants. And it requires both in-class exercises as well as a full one-day retreat. In addition to that, participants are also, or patients are expected to engage in about 45 minutes of home practice as well. So it is quite intensive and demanding. The aim of this intervention is for individuals to learn to be less reactive and judgmental towards their experiences. So for example, in this context, that would be towards the experience of pain. And I'm sure you can remember that we spoke about the definition of mindfulness being accepting, non-judgmental to whatever was going on and occurring in a particular moment. And mindfulness-based stress reduction as a clinical intervention is shown to have a whole lot of benefits for a whole lot of outcomes. So we can see that it decreases symptoms of depression, anxiety, can decrease rumination, can decrease stress. The list goes on. It can also improve affect, improve empathy or increase empathy, increase mindfulness and self-compassion, which we'll talk about a little bit later, and quality of life. Mindfulness-based cognitive therapy is a little bit more recent and perhaps something that we're all maybe a little bit more familiar with. It's quite similar to mindfulness-based stress reduction in that it's quite structured. It goes for about the same duration of time and requires about the same weekly commitment as well. It includes group mindfulness practices and cognitive exercises. So it's a combination essentially of a mindfulness-based therapy and a cognitive-based therapy. And it also incorporates some gentle hatha yoga, which is a form of yoga asana or physical movement practice. And the aim of this is to help individuals essentially disengage from their thoughts or their negative psychological effects of their thoughts as they come up. And it's been really shown to be really beneficial in terms of depression in particular. So we can see that mindfulness-based cognitive therapy has been shown to reduce relapse and prolong the time to relapse in people that have had more than 3 depressive episodes. It can also reduce symptoms in current depression. And it can reduce residual symptoms and improve quality of life in individuals with remitted depression. There's also some reduced symptoms of depression in individuals who have comorbidities like bipolar, social phobia, or epilepsy. And here's just a little bit of an overlap to show us some of the similarities and differences between mindfulness-based cognitive therapy and mindfulness-based stress reduction. So we can see that they both include mindfulness as a key component, paying attention to experiences, thoughts, emotions in the body, and that they have a very similar structure in terms of their format. But they do differ in some ways. So, for example, mindfulness-based stress reduction is aimed these days more towards the general population. It helps people to manage things like stress, pain, grief, etc. Whereas mindfulness-based cognitive therapy is more so focused towards depression symptoms, depression relapse, etc. Dialectical behavior therapy is the next one we'll talk about. It essentially is a combination of cognitive behavioral therapy blended with some Zen philosophy and practice. And the aim of this is also to increase self-acceptance as an exposure therapy. Ultimately, we're wanting people to reduce the amount or level at which they avoid things that are difficult for them. So we often spend time avoiding difficult emotions or difficult thoughts or feelings. And DBT, or dialectical behavior therapy, aims to reduce this pattern. It's also quite time intensive and structured. There's 4 treatment stages or skills modules, as we can see in these 2 images. But all of the other, I guess, mindfulness is integrated into all of these different modules. So it sort of follows people throughout the whole program. And DBT is used quite commonly as an intervention for individuals who have borderline personality disorder. And in these individuals, it's been shown to reduce the frequency or severity of self-harm behavior or parasuicidal behavior as well. The number of inpatient psychiatric days, the number of hospital visits, the number of hospitalizations resulting from those hospital visits, and also, interestingly enough, to decrease substance use. And some modifications of DBT or dialectical behavior therapy have also been found to be beneficial for individuals with binge eating disorder and bulimia, as well as chronic depression, particularly in elderly individuals. Now, the last particular therapy I want to talk about is acceptance and commitment therapy. So this is quite unstructured compared to what we've looked at just now in the last 3 types of interventions. And it's based on the premise that psychological distress is often associated with these attempts to control or avoid negative thoughts and emotions. And this, paradoxically, can increase the frequency and intensity of these events. And that just, of course, results in further distress and an inability for us to engage in behaviors that ultimately might lead to long-term goals and improved outcomes. So as we can see from this image here, there's 6 core treatment processes that are explored in acceptance and commitment therapy. And mindfulness skills are taught in the context of 4 of these. We can see that it can be range from 1 day to 16 weeks in its duration, and it can be delivered in a group or an individual format. So it's far more flexible in terms of how it can be delivered. And it's been tested in a number of RCTs across a range of mental health outcomes. It's been found to be effective compared to treatment as usual in improving affective symptoms and social functioning and lowering rehospitalization rates among psychiatric inpatients who have psychotic symptoms. And in individuals with depression and anxiety symptoms, ACT or ACT, acceptance and commitment therapy, has been shown to reduce levels of depression, anxiety, and poor mental health outcomes. It's also shown to be effective at reducing substance use and dependence among individuals who are nicotine dependent. Now we're going to move out of the clinical setting now and look at non-clinical settings. So the first thing we'll talk about is yoga as a mental health promotion strategy in the general population. And yoga has been seen to decrease symptoms of depression and anxiety in the general population, as well as the number of depression episodes in clinical populations. It's been shown to decrease stress, decrease fatigue, and also decrease symptoms of post-traumatic stress disorder. Yoga essentially means to yoke or bring together, to form union between mind, body, spirit. and it describes a lifestyle that aims to achieve this union. Of course, we're not going to talk about so much of the history of yoga here, but essentially it does come from an Indian origin. But these days, when we talk about it, as I was mentioning, in a psychological health context, we are doing that independent of any philosophy or spiritual sorts of goals or aims, ultimately. There's so many different forms of yoga that it is really hard to define what yoga is. But many forms of yoga share common elements. These can include controlled breathing, physical postures, and meditative techniques. Speaking of meditative techniques, meditation has also been shown to be really beneficial for mental health. And there's many forms, again, of meditation. We won't talk about all of them, but just as a little highlight, there's concentrative, mindfulness, transcendental, but that's a little bit secondary to what we're focusing on today. But generally, all forms of these meditation involve some component of concentration and mindfulness. And meditation, again, has been shown to decrease symptoms of depression, anxiety, and pain. So, for example, a systematic review of meditation involving 3,315 participants showed that mindfulness meditation programs improved anxiety at 8 weeks, depression at 8 weeks, and pain. And there was some low evidence that they improved stress and distress and quality of life in diverse clinical populations. This was compared to active control groups. So how might mindfulness do this? We're going to just take a brief look at some psychological processes now. So self-compassion essentially is our ability to be kind to ourselves. It's how we might treat our best friend or somebody that we care very dearly for. So instead of being critical and judgmental, we're instead being very compassionate and kind. We know that individuals who have higher levels of self-compassion experience less anxiety after they've been exposed to a stressful event. And in young people, individuals up to 18 years old, high levels of self-compassion are associated with less depression symptoms. And individuals with low self-compassion have higher levels of depression symptoms. We can see this after somebody's engaged in a stressful event, like the social stress test, which is essentially a experimentally manipulated condition in order to have individuals feel a degree of stress. So essentially the research shows that individuals with high self-compassion experience less stress in reaction to the stressful event, and they experience less anxiety, and that's also associated with high levels of satisfaction. Interestingly enough, this is also corresponds or correlates with decreases in blood pressure, systolic blood pressure, SBP. We've got it abbreviated here, which is one of the things that is shown to increase when somebody is stressed. So this indicates that people are having a reduced or smaller stress effect. So the take-home message is essentially that self-compassion can decrease stress and can improve mental health and well-being. And exposure is another process that several individuals have argued may occur during mindfulness practices. So essentially, by paying attention to experiences in a non-judgmental and open manner, individuals may undergo this process of desensitization. And this means essentially that the distressing sensations or emotions that usually they would avoid become less distressing and therefore perhaps less avoided. So some authors have proposed that prolonged observation of current thoughts and emotions without trying to escape them or run away from them can be seen as an example of exposure. And this can result in this extinction of the fear response. And finally, I want to touch on metacognition. So metacognition essentially is our ability to decenter or view our thoughts, observe our thoughts from above. I'm thinking about thinking, I'm seeing, I'm smelling, etc. And also to view our thoughts, therefore, as passing mental events rather than to identify them with them or believe them to be accurate representations of reality. So increased metacognitive awareness has been hypothesized to lead to reductions in rumination. In one randomized control trial, Teasdale and colleagues found that mindfulness-based stress reduction, which is a mindfulness-based intervention, as you can remember we spoke about earlier, increased metacognitive awareness compared to treatment as usual in 100 patients who were in recovery from major depression. So essentially, increased metacognitive awareness can predict better clinical outcomes in individuals. And that's everything from me today. Thank you very much for joining.